When Memphis rap star Young Dolph was gunned down in Memphis, some of the first to hit the streets were interveners, people sent in to quell any type of retaliation, which many times is key to preventing more gunfire. Now the Shelby County Health Department wants to get more interveners in the community.
And they are getting big money to make it happen. WREG's April Thompson shows what they have planned and how others can get involved too.
Crime, now called an epidemic in communities across the country. The Shelby County Health Department, at the forefront of fighting epidemics, has now set its sights on crime in the Bluff City.
Because violence is the public health issue. It affects all of us.
The Health Department is armed with a $1 million grant from the Tennessee Office of Criminal Justice to tackle crime. They're turning to the Cure Violence organization's approach, treating crime as an infectious disease and targeting communities where crime is more rampant.
Violence is contagious. It can be transmitted, and therefore it could be interrupted and detected. So their approach is they try to detect and interrupt conflict before it manifests and grows and spreads.
Their theory, a murder is the result of a chain of events that preceded it. If you can intervene earlier in that chain of events, you can prevent deadly outcomes.
The recent incidents where one young man shoots the other young man at school, but that could have easily exploded into a retaliatory situation. 13-year-old shoot another 13-year-old. The 16 to 18-year-old brother is going to take retaliatory action.
The model calls for having street interrupters. They have what is called street cred, and they're willing to use it to change things. Say there's a shooting, they're the ones who show up to talk down revenge.
They're in the hospital and just kind of talk to them and see where their heads are, and if there's any indication that, hey, you know what, this is going to lead to some retaliatory action or response, then they try to talk them out of it. Try to see if there's another way that we can resolve this.
The chief program officer for Cure Violence Global says this approach is key to making the program work.
Having staff from the community working with folks they already know in a way that's non-judgmental, really focusing on the violence and trying to provide support.
It's very similar to 901 Block Squad, a program started by the city of Memphis back in 2012. Members work in the streets to quell situations before they turn violent.
So we try to go in and build relationships out and help our guys and girls resolve their issues before the guns come up.
Delvin Lane helped grow 901 Block Squad from 5 workers to now 25. On any given evening, you will find the squad in hotspot locations, talking to young people and families. They know the players and often know when something is about to go down.
They've been working in the community for a long time. You know, we got people who was at Streets Ministries for multiple years, building relationships, changing thousands of lives. We got ex-gang members and drug dealers that know the city. We got ex-coaches.
There are now even women interveners.
A lot of young ladies like to talk to other young ladies when they're going through situations and trials. Then you also have a lot of young men that can trust young ladies to where they may not feel like they can trust other men.
And for the Cure Violence Initiative to work in Shelby County, recruiting will be key. But case managers and social workers will also make sure people have basic needs so they don't have to resort to crime.
Some shoes to be able to go to school. If I need, some assistance on to get driving license, to get a birth certificate or whatever. Any type of thing, intervention that will help someone.
The program will start in Whitehaven, and the request for proposals will soon go out for organizations who want to take a lead starting up Cure Violence here. Training will start the first of the year. The health department's job is to monitor everything. And based on what's happened in other cities, the Cure Violence program has been turning things around.
Reducing hotspots, so reducing shootings per square mile, right? reducing actual homicide numbers and shooting numbers, right, in a community, like you can see reductions, right, and you can see changes in terms of the number of folks that are dying, the number of people showing up in the hospital.
So these won't be volunteers. This will be paid individuals. And their job will involve working times of the day, different hours, because a lot of the things that happen often happens after midnight.
How are you hoping that this will make a difference in the crime that we're seeing in Shelby County?
It's very important that we understand that this is only one of numerous approaches that must be implemented to address the problem. The hope is that this will spread to other communities. But we also have plans to try to implement some other mentoring type programs to be implemented in households, churches, schools. We got to do something, and everybody has a role to play.
April Thompson, WREG News Channel 3 investigators.
They are looking for some solutions. The health department says some cities that have implemented the Cure Violence approach have seen a 50% reduction in their crime rate.